I am Dr. Sylvia Marjan, currently doing my internship at Chitwan Medical College, and I will be your host for today. It gives me immense pleasure to stand here in front of you today and welcome you all to this grand event. On behalf of the organizing committee and the Psychiatrist Association of Nepal, I would like to thank you all for being such an integral part of the 9th PanCon 2020. Mental health, a topic most people don't like to mingle into any conversation. It is difficult for the society to accept and change the views regarding their beliefs relating to mental health. As defined by the WHO, health is defined as the state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. This statement emphasizes what a healthy individual should possess: an active body, a sound mind, and an accommodative social life. For a large, unimaginable number of people, health concerns the physical aspects only. Lesser do they know, it is the mental well-being that plays an equally important part in maintaining the inherent health. Like every other organ can be affected by disease, brain, despite its amazing capabilities, can get sick sometimes. And we, spellbound by its greatness, refuse to admit that mental issues are real. The most learned mind here must have experienced innumerable cases of patients and their families denying the fact that the patient needs medication. It suddenly becomes a hush-hush topic that they pretend to not know. To depict the current scenario, for a very long time, those acquiring psychiatric illnesses have been accused of being supernatural beings with magic and power. The verdict passed by the society has created unprecedented fear of being an outcast from the very society which is the backbone of our human civilization. Like the roots of a banyan tree, the stigma is deep-rooted into the culture, which is difficult to vent out. Today, we gather here, each and every individual having at least a couple of such unusual experiences to share, teach, and learn things that may, in future, prove to be useful in eradicating the discrepancy between the ideal definition of health and the real health that we strive for. Besides the clinical areas, psychiatry has a huge responsibility towards healing the social abrasions created by mental illness. The wave of change starts with an individual. PanCon 2022, Mental Health in Changing World, is the theme appropriate in this vast and ever-evolving world. Change is the only everlasting process, and to mold ourselves according to the changing world is the biggest survival tip. Survival of the fittest is a statement we all have heard, and to fit into this modern world, turnover is mandatory. Like each aspect of life needs us to be competent in different roles, mental health must also be viewed at angles the world has never seen before through the changing lens. Recent advances in medicine and technology aids in the way we approach patients and enhances the treatment. Keeping this in mind and ever ready to accept what comes our way, let us begin our pre-scheduled events. Once again, all the distinguished personalities, highly respected psychiatrists, mental health professionals, and the MD residents present here today. It is an honor to have you all here. Now, we shall begin the inaugural session with the formal seating of the dignitaries. I would like to request respected Professor Dr. C.P. Sedai, President of Psychiatrist Association of Nepal, to take his seat of honor as the chairperson of today's inaugural. Accordingly, I would like to invite respected Dr. Roshan Pokhrel to take his seat as the honorable chief guest. Now, I would like to request the Nepal Medical Association Central Vice President, Dr. Anil Karki, to take his seat. Thank you. Now, I would like to request Nepal Medical Association Chitwan President Dr. Lok Bahadur Sedai to take his seat. Thank you, sir. Further, I would like to request the Vice President of Psychiatric Association of Nepal, Dr. Ravi Shakya, to take his seat. Thank you, sir. I would like to request the General Secretary of Psychiatric Association of Nepal, Dr. Neena Rai, to take her seat. Thank you, ma'am. Moving on, a sincere request to the General Secretary of PanCon 2022, respected Dr. Khagendra Kafle, to take his seat. Thank you, sir. Now, I would like to request Professor Dr. Gopendra Prasad Teo, Academic Director of Chitwan Medical College, to take his seat. Thank you, sir. Now, I would like to request the Hospital Director of Chitwan Medical College, Honorable Professor Dr. Dayaram Lamsal, to take his seat. Thank you, sir. I would like to request Professor Dr. Shailendra Raj Adhikari to take his seat. A humble request to the scientific convener, Honorable Professor Dr. Dhanu Ratna Shakir, to take his seat. Thank you, sir. I would like to request the Director of Mental Health Section of the Non-Communicable Disease, respected Dr. Fanindra Baral, to take his seat. Thank you, sir. I would like to request all the members of the organizing committee to take their respective seats. Further, I humbly request all the psychiatrists present here from various parts of the country and different health facilities, medical colleges, and hospitals to take their respective seats. Now, I would like to request the MD Psychiatry residents also to take their respective seats. A sincere request to all the medical personnel and healthcare workers from various medical fields to take their respective seats. Thank you, everyone. To mark the illuminance of knowledge and wisdom which the light signifies, let us come together to commemorate the program. To do the honors of lighting the panas, I would like to request respected Dr. Roshan Pokhrel to come forward. Thank you, sir. Moving on, I would like to request all of you present here to stand up for the national anthem.
थुङ्गा फुलका हामी एउटै माला नेपाली सार्वभौमै फैलिएका मेची महाकाली सयौं थुङ्गा फुलका हामी एउटै माला नेपाली सार्वभौमै फैलिएका मेची महाकाली प्रकृतिका कोटि कोटि सम्पदाको आचला वीरहरूका राजपाले स्वतन्त्र ज्ञान भूमि शान्ति भूमि तराई पहाड हिमाल अखण्ड यो प्यारो हाम्रो मातृभूमि नेपाल बहु जाति भाषा धर्म संस्कृति छन् विशाल अग्रगामी राष्ट्र हाम्रो जय जय नेपाल।
Thank you, everyone. Now, to deliver the welcome speech, I would humbly request the Psychiatric Association of Nepal Secretary, Dr. Neena Rai, to come on stage.
Thank you, Sylvia. Good morning and namaste, Honorable Chief Case, Health Secretary, Dr. Roshan Pokhrel sir, dignitaries, esteemed speaker, delegates, ladies and gentlemen. On behalf of Psychiatrist Association of Nepal, it is my utmost pleasure to welcome all of you in this 2 days conference of Psychiatrist Association of Nepal 2022, Sauraha, Chitwan, Nepal. I welcome all of you from all over the country, from different walks of the life who has come here to share your vast knowledge and experience. This 9th PanCon has a lot to offer in terms of academic endeavors. The scientific program covers a wide spectrum of topics, along with the oration, guest speakers, keynote address, workshop, symposium, and plenary sessions. I believe that this will definitely provide a light, mix to enlighten you all with the latest practices. I would like to thank you all for turning out in such a great number. The level of interest shown is quite encouraging for all of us. I believe that the organizing committee has left no stone unturned. They have really worked hard to make this conference a success. I wish them best of the best. And lastly, I hope after this conference, you will carry back the long-lasting memories of not just the the scientific excellence, but also the warm hospitality. Thank you. Have a pleasant stay. Once again, I would like to welcome each and every one of you. Namaste.
Thank you so much, ma'am. Now, to extend the best wishes, I would like to request Dr. Mahendra Nyupane to come on stage.
Thank you very much. Good morning. I am Dr. Mahendra Nyupane, senior psychiatrist. Here, this is my, I have gave a good opportunity to give some speak here. First of all, I would like to extend my warm welcome to everyone on behalf of 9th National Conference of Psychiatric Association of Nepal. With due respect, I would like to address today's PANCON Chairman and PAN President, Professor Dr. C.P. Sauraha, Chief Guest, Ministry of Health, Secretary, Senior Psychiatrist, Dr. Roshan Pokhrel, delegates from Nepal Medical College, delegates and representative from CMC, and others. And I would, and delegates from outside the countries, especially India and other European countries, I would like to welcome again in this beautiful tourist city, Sauraha. PANCON is another festival. Yes, we already celebrated our great festival as Bada Dasai, that is Dasra, Tihar, Diwali, and Chhat. Like this, today we already listen and hear some papers, and we, on the basis of our theme, mental health in changing world. So we are benefited and have little bit gather valuable knowledge by hearing them from their topics, and we'll also later on we'll hear these all other topics. Then we will gather valuable knowledge. I wish our PANCON would be successful and fruitful. At the end, I would like to request all the delegates, please watch our wild animal lives, very beautiful birds you can see, and the forest, small rivers, and natural views. I request all the delegates from outside the country and inside the country, please enjoy your stay in a beautiful city, Sauraha. Thank you very much.
Thank you, sir, for your valuable words. There are minor moments in life which are sewn together to create a significant impact. Similarly, these moments create momentum and thus help in achieving things that are thought to be impossible. This has been depicted in the life of the highly respected dignitaries who are being awarded the Lifetime Achievers Award today. Living an inspirational story, striving for excellence, overcoming hardships with a smiling face is what these great people have done. And most importantly, they have inspired people to do better. Therefore, to commence the felicitation of Lifetime Achievers, I would like to start with the introductory CV. To begin with, respected Dr. Nirakar Man Shrestha. Born in Tehrathum, Manglung on 19th January 1948, Dr. Nirakar Man Shrestha completed his school education from Sinha Bahini High School, Tehrathum, following which he completed his intermediate level in science from Public Science College, Kathmandu in 1965. He graduated his MBBS from King George's Medical College, Lucknow, India in 1970. He did his post-graduation MD in psychiatry from AIIMS, New Delhi, India in 1985. He has done diploma in addiction behavior from Institute of Psychiatry, London in 1992. He has also done fellowship from the College of Physicians and Surgeons in 1998 from CPSP, Pakistan. He served as a secretary in the Ministry of Health and Population, Government of Nepal. He is the first health secretary from medical field in the history of Nepal. He was the former Director General of the Department of Health Services, Government of Nepal. He also served as the Chief Specialist and head of all the 3 divisions of Ministry of Health and Population, Government of Nepal. He has served as the Chief Consultant Psychiatrist in Mental Hospital, Lagankhel, Lalitpur, Nepal. He was former Senior Vice President of Nepal Medical Association. He is currently working as a Senior Consultant Psychiatrist. He has been to numerous international meetings, seminars, and workshops around the globe, and he has penned down more than 10 different books. He has also published more than 50 articles in different national and international journals. Dr. Shrestha has received many awards, medals, and appreciation for his distinguished services. I would like to now request our chief guest, Honorable Dr. Roshan Pokhrel, to felicitate Dr. Nirakar Man Shrestha with the award.
Psychiatrist Association of Nepal, Sauraha, Chitwan, Nepal, Lifetime Achievement Award. Felicitation by Psychiatrist Association of Nepal, PAN, on the occasion of 9th National Conference, PANCon 2022, dated 3rd to 4th November 2022, to Dr. Nirakar Man Shrestha, a seasoned psychiatrist and former Health Secretary of the Government of Nepal, for your valuable and untiring efforts in the field of mental health, a pioneer psychiatrist with invaluable dedication to the PAN. The dedication and perseverance you put in pursuing your noble vision to alleviate the sufferings of Nepalese people is an inspiration story to mankind. We felicitate you for your valuable contribution and commitment towards psychiatry and mental health. May the Almighty bestow you and your family with happiness and prosperity. Thank you.
Thank you, Dr. Roshan Pokhrel, sir. I would like to request respected Dr. Nirakar Man Shrestha to enlighten us with his words.
Chairman of this inaugural session, President of the Psychiatrists in Nepal, Dr. C.P. Shenai, Chief Guest, the Health Secretary, Dr. Roshan Pokhrel, other dignitaries in the dais, my senior colleague, Dr. Dhruman Shrestha, my other psychiatry colleagues, distinguished delegates from abroad, all mental health personnel, and ladies and gentlemen. First of all, I would like to thank the Psychiatric Association of Nepal for bestowing on me this distinguished Lifetime Achievement Award in this August gathering of inaugural ceremony of PANCOM 2022, that is National Conference, 9th National Conference of Psychiatrists in Nepal, in Sauraha, which is a very loving, very historical and tourist spot of Chitwan district. Now coming to my experience, I have 52 years of experience in medical careers, starting right from medical officer to the health secretary of government of Nepal. So there will be many, many experiences, but my experiences will be confined to only two aspects. That is how to improve the status of mental health in Nepal, and some of my experience while doing the psychiatric practices in Nepal and abroad. Not only psychiatrists and clinical psychologists, but also other mental health manpower such as psychiatric social worker, psychiatric nurse, occupational therapists, etc. should be produced in a planned manner. It is also equally important to retain this trained manpower and distribute them throughout the country and use their knowledge and skills in effective and efficient way. Inclusion of appropriate psychotropic drugs for appropriate level of health services should be made in the country's essential drug list. Provision of free supply of psychotropic drugs should be made for the poor patients, and the provision of supply of psychotropic drugs in the subsidized rate for other patients should be made. Mental health legislation is very important for the protection of human rights of mentally ill people, and it should be materialized in our country as soon as possible. All the stakeholders in the field of mental health should be involved in the process, and it should be consistent with the international human rights obligation, and also should be in tune with General Assembly Resolution 46/119 on the protection of persons with mental illness and the improvement of mental health care adopted by UN in 1991. The grassroots level health workers, such as village health workers, maternal child health workers, and female community health volunteers are present in all the villages throughout the nook and corner of the country. They belong to the same village as the villagers or the target population and share same cultural beliefs and languages. Since they visit door to door in the village, they have the confidence of the people and are more acceptable, accessible, and they are affordable to the villagers. They have played significant role in reducing the maternal mortality rate, infant mortality rate, under 5 mortality rate, and other health indicators of the country. Therefore, they should be trained and used for mental health education and awareness, and also for identifying mental illnesses in the community and refer them to the nearest mental health institutions. 90% of mental patients visit faith healers and before coming to mental health institutions or mental health specialists. Faith healing is the reality, and it will be always there in our country. The faith healers are present in all the villages throughout the country, and usually the first ones to be contacted by the villagers. Like the grassroots level of health workers, they also belong to the same village as the villagers and share the same cultural beliefs and languages. Since they are available in all the time and have the confidence of the people, they are more acceptable and accessible to the villagers. Therefore, these faith healers should also be motivated, trained, and used for mental health education and awareness, and also for identifying mental illness in the community and refer to the nearest mental health institutions. But we have to be careful to do this very tactfully so that the faith healers should feel part of the team, and at the same time should not feel that their profession or livelihood is in danger. Community mental health programs should be given priority as they have the following advantages over the institutionalized treatment. Early intervention is less stigmatizing, is cost-effective, more respect for the human rights, is more acceptable, more accessible, more affordable, and better outcome and better quality of life. At present, the budgetary allocation for mental health is extremely inadequate. Disease burden should be one of the criteria for the allocation of the budget. For the allocation of the budget, minimum of 20% of the national annual budget should be given to health sector, and out of that, at least 10% should be given to mental health. And I call it 10 by 10 formula. This is my own personal formula. Since mental health issues are multi-sectoral in nature, a high-level intersectoral coordination committee consisting of all the stakeholders should be formed in the ministry level with the clear terms of reference. We should avoid using the term mental illness or mental disorders, and instead specify the specific disease like in physical disease, as it has the following advantages. It is more scientific, it is less stigmatizing, it is more acceptable, it is more convincing, it is better for advocacy, and it is better to get more budget. Therefore, the World Health Organization should think in this direction, not only to reduce the social stigma attached to mental illness and mental patients, but also to help in using more scientific and more meaningful terminology in mental health. Last but not the least, the National Mental Health Policy, Strategies and Action Plan was adopted by the government of Nepal on 1997, February 10, when I was working in mental hospital. It has been implemented only partially so far, as this document has covered primary prevention, secondary prevention, and tertiary prevention of mental health and mental illness. It should be implemented fully as soon as possible. Now, I would like to read out some of my experience in my psychiatric practice. A 13-year-old girl in my clinic with ultra-rapid cycling bipolar disorder responding very well to a small dose of olanzapine. A 35-year-old man with bipolar disorder with tardive dyskinesia involving neck and trunk caused by haloperidol liquid given to him without the knowledge of his wife, without the knowledge by his wife, off and on for several years without the prescription of a doctor. A young female teacher with temporal lobe epilepsy who spat on the face of the headmaster during one of the attacks and got dismissed from the school. A male patient with generalized tonic-clonic seizure with post-ictal psychosis who happened to kill his own teenager son during one of the attacks and then sentenced to jail. A male patient with schizophrenia with commanding hallucinations, killing his wife, chopping up the dead body into pieces, packing the pieces in a box, and throwing the box just behind his house. Mass hysteria in a girls' school, in a girls' hostel in Dhankota campus when I was posted there as medical officer in 1972. 15 to 20 girls used to howl and get the thrusting movement of body below the waist. It was a very difficult knot to crack for me, but I could manage to crack it somehow. A middle-aged, very tall and muscular man with bipolar mania with extreme irritability and physical aggressiveness in my bed while doing MD psychiatry in AIMS in New Delhi. My senior resident then, Dr. Shekhar Saxena, was the director of the Division of Mental Health in Geneva, now retired. We both managed this case by giving him 12 diureticity in his bed whenever he slept. There was a case of young married lady with hypomania in my bed while in AIMS. Whenever she saw me, she used to embrace me and tightly and kiss me in my face. I had a very difficult time with her. I used to run away from her, but she used to chase me. I still remember this case when I was in AIMS, and it happened for 1 month till she was discharged. There was a case of major depressive disorder with psychotic features admitted in mental hospital in my bed. She recovered very well with medication and diureticity and was about to get discharged the next morning. But unfortunately, she was found hanging in the upper floor of the mental hospital, tying a rope in the railing of the staircase. I had experience of sexual advances by 12 to 15 female patients, but I could manage the situation with full presence of mind, common sense, and limiting myself within the medical ethics. A 19-year-old boy attempted suicide by hanging after he suffered from repeated images of having physical relation with his own mother. In the treatment of epilepsy, I think especially in the developing countries, the following points need to be kept in mind. The effectiveness of the drug, no serious side effects, and cheap and affordable for a long period of time. Availability should be easily available, easy to administer. As phenobarbital fulfills all these criteria, I have been using phenobarbital as first line of AED in almost all cases of epilepsy. Mostly monotherapy is enough, but in about 30% of cases, I have added phenytoin sodium as second line, and in less than 10% of cases, I have used third AED. Patients vary very much in dependence potentiality with benzodiazepines. Like endogenous opiates, we call it endorphins, probably there are individuals who are deficient in endogenous benzodiazepines and are more likely to get anxiety symptoms and dependence, even in small doses of benzodiazepines in a very short period of time. Alcohol dependence with delirium tremens frequently come to my clinic. I treat them with chlordiazepam starting from 100 milligram to 160 milligram to start with, and tapering the doses slowly. As I have noted, relapses more commonly when chlordiazepam is stopped in early stage. I don't stop it after 7 to 10 days and continue in small doses for at least 3 to 4 weeks. I did not admit any of them and treated all of them on outpatient basis, and I never used antipsychotics in these DT cases. Knowingly or unknowingly, non-psychiatric physicians such as neurologists, neurosurgeons, cardiologists, chest physicians, etc., treat considerable number of mental patients and keep on holding them for a long time and subjecting them to undergo unnecessary and expensive investigations. Refilling of prescriptions by pharmacists for several months and even for several years is quite common. Some of these patients have come to me with serious side effects, including tardive dyskinesia and teratogenic effects in the fetus. Ministry of Health and Population in general, and Department of Drug Administration in particular, should take this matter seriously and take necessary measures to stop this practice by pharmacists in the country. Double seizures, like double depressions, is not uncommon, and if this is not kept in mind, the diagnosis is often missed. In my experience, I found that chronic OCD cases, that is my personal experience, chronic OCD cases are the most difficult patients to manage. These cases suffer themselves, make the family members suffer, and make also others suffer for a long, long time. Now with this, before I conclude, I would again like to thank the Psychiatrist of Nepal for honoring me with Lifetime Achievement Award. Thank you all very much for your time. Thank you very much.
Thank you, sir, for your valuable words. On to our next awardee. It is an honor for me to introduce him to the crowd today. I'm going to share a short CV of Honorable Dr. Vishwabandhu Sharma. Born on 27 May 1953 in Siangja, he received his informal education at home from 1957 to 1964. Following that, he studied ISc in Anandakuti Science College, Swayambhu from 1969 to 1972. He received his basic medical education, MD, from Kharkov State University, Russia, former USSR, from 1972 to 1979. From 1979 to 1982, he completed his postgraduate specialization in psychiatry from the same institute. Then he worked in a government hospital, namely Mental Hospital Kathmandu, from 1982 to 1993. He worked privately at different communities across Nepal, outside the Kathmandu Valley, providing information to the general public on mental health. He is the pioneer in establishing the first private inpatient psychiatric services in Nepal. Since 2009, he has been working as a private practitioner and a part-time consultant psychiatrist in Medicare. He has penned down 2 books titled Manasik Swasthaka Vibhit Ayam and Mancheko Mon. Therefore, I would like to request the chairperson of this program, respected Professor Dr. C.P. Sedai, to present the award to Dr. Vishwabandhu Sharma.
On the occasion of 9th conference, PANCON, dated 4 November 2022, Dr. Vishwabandhu Sharma, psychiatrist, for your valuable and enduring effect in the field of mental health, dedication and perseverance, and pushing your novel vision, elevate the suffering you have, how a person can transcend about the country and work for the community and for greater cause of humanity. We facilitate you, your valuable contribution and commitment toward the psychiatry and mental health. May the Almighty bless you, your family, with happiness and prosperity.
Thank you, Professor Dr. C.P. Sedai. A humble request to Dr. Vishwabandhu Sharma to share his insight and experiences with us.
Good morning. Namaskar. I am not going to take much time, so I will not bore you. Dignitaries at the dais, dear colleagues, my friends, distinguished guests, very good morning to all of you. First of all, I would like to thank Psychiatric Association of Nepal and this executive committee and this organizing committee of the 9th National Conference for providing me this opportunity to be here to speak in front of you with this with an honored title and with this as an achiever, lifetime achiever. Thank you very much. Now when I am standing in front of you, I am a bit overwhelmed with mix of emotions. I am a bit excited also and also a bit embarrassed. I am excited because it was quite surprise and I didn't expect it, this event actually. I thought maybe 15, 20 years down the road and I become old enough and with with gray hair and a beard, with a stick, walking stick, coming here and in front of you with 15 more experiences working in community and with my patients, as well as publishing a few more books which I am planning, could be even much better, but I am hope that that day also will come too. A bit embarrassed because, all these 43 years of my career, my professional life in psychiatry, including 3 years in my training, since 1979, I did all day in and day out, I did only a few things. My vocation in psychiatry included consulting the patients, reading and writing. Day in and day out, reading, writing and consulting. That was all what I did. And still I am doing the same thing. I am already 40 years in Nepal. And I didn't take even a 1 week's break in my life. So I am really immensely happy and really thankful to PAN for recognizing me, my small, modest contribution to this country. And the other day when I got this news that I will be felicitated, I was wondering what should I enlist as my achievements as an achiever, and what should I speak in front of this August gathering, in front of my colleagues, friends, and then nevertheless, I would like to share some of my experiences, some of my modest works It was around 30 years ago, mental health service was limited only to Kathmandu Valley. I, in my own capacity as a psychiatrist, I tried to bring the service out of the valley. And I choose 5 different places around the country, and I started doing regular routine sort of follow-up clinic for those patients. The reason why I started doing it, every day I see the patient in the OPD coming far away, right from far east and far west, even not only for consultation and follow-up, even to refill the prescription, they had to come to Kathmandu. That was so terrible, and then I thought, why not myself to go to them? So that way I started, and that was in a way somehow facilitated, I suppose, to spread the mental health service beyond Kathmandu Valley, and now we see a lot of medical colleges and psychiatry department in private as well as in government and public sectors. So I feel very proud that my work at that time, and it was not in vain. And I continued that way almost for 15 years, and never missed a single trip. I dreamed some sort of hospital, mental health care on wheel, and that was my concept. But I could not somehow, because of I'm very weak in management and in leadership quality. So I worked, but I could not manage it properly. And then the rush of patients was so high, and so that it was very difficult for me to handle. And gradually I have to withdraw it. By that time, the services also became available. And one more thing I wanted to share is when I joined mental health service in this country, most of the new graduates, medical graduates, were not interested to come to psychiatry. Even they didn't have any opportunities in other fields, and it was very difficult to convince them. My job, and I tried my level best, and always used to say that, look, how happy and content I am being a psychiatrist. I am happy, I am here, seeing my patients. I may not be earning that much money, but I am transforming the life of a patient. And not only that, I used to convince them, look, if you become a cardiologist, you become a doctor, a good doctor, a cardiologist. I used to say that, look, if you become a psychiatrist, you have to study not only medical science and biology, you have to study history, you have to study sociology, you have to study literature, you have to study art. You have to be a really perfect doctor. Then only you can feel as you are a doctor. Doctor is an enlightened person. Doctor is not only educated, is an enlightened, a wise man. So to be a wise and enlightened, you must have to be surprised. Okay. Many of them were convinced, and very interesting thing I wanted to say. One very bright student, bright medical graduate, he already was enrolled in this PG program, the residency in ENT, already enrolled. Somehow he is convinced, he dropped, he quitted it, came back to mental health, became a psychiatrist. And I heard that later on he became the clinical director in one of the mental health institutes in the UK. And he is a fellow of the Royal College also. That the doctor whom I motivated and brought to this field. And even many young psychiatrists who just finished their PG program, I tried to attract and involve in I had a modest setup to come and work with me, to somehow in my capacity to teach and more to inspire. And many of them now I see, even in this hall, many of them, they are now professors, they are now HODs, they are researchers, scientists. Really it is, for me as a teacher, I am not a teacher actually, as a humble person, just seeing that, and those my young brothers and sisters, and seeing in that position is really a great satisfaction to me. By the way, now we are here in this city. I want to just describe one incident in my life when I was touring this country. And this is also one of the spot, this Bharatpur, this town was also one of the spot which I selected. When first time I came here, Before coming here, I call all my patients who were, all the patients who used to come to Kathmandu and to come here, and so they were here, patients were there for follow-up, and some new were also there, but there was no medicine. There was no medicine, no psychotropics. Not a single chemist agreed to bring it and to keep it. Then somehow I convinced reluctantly one chemist, and he brought from Kathmandu some stock. And when I started seeing the patients, just with the first day, in the first morning, all the stock was finished. So I had to wait another 2 days. Another 2 days still, and he brought some more stuff. And that way I started my this follow-up, this outreach program in this town. Now I see there are 2 medical colleges with full-fledged mental health psychiatric departments with wards and OPD, and there is government hospital with psychiatric beds, and a beautiful private hospital. So I see all this development, and this conference in this city it comes to the full circle of my beds. I am really immensely happy. So with these words, I don't want to bore you more, because now all of us are very the lunch is waiting, and the other programs speakers are there, so I won't take much time. And lastly, I wish you all delegates and our guests from abroad, our distinguished speakers, I wish you a pleasure stay here, enjoy the weather, enjoy the nature, enjoy the hospitality of our friends in Chitwan. Thank you.
Thank you, sir, for your kind words. We were expecting the president of SARC Psychiatric Federation, Dr. Gautam Shah, but unfortunately he couldn't be here today due to the flight delay. Now, proceeding, I would like to invite Honorable Chief Guest, Dr. Roshan Pokhrel, to say a few words.
Thank you. Yes, 9th National Conference of Psychiatric Association of Nepal का उद्घाटन समारोह का अध्यक्ष आदरणीय सुविदाई, दाइसमा उपस्थित सहकर्मी साथीहरू, मेरा अग्रज सिनियर सरहरू र साथीहरू, मैले यो डाइस छिटै लिन खोजेको चाहिँ 1 बजे अर्को कार्यक्रममा पनि भरतपुर पुग्नुपर्ने भएको हुनाले मात्रै हो। प्यानमा आएर एज अ सेक्रेटरी केही भन्न पाउँदाखेरि प्यानलाई हार्दिक धन्यवाद दिन चाहन्छु र मलाई चिफ गेस्ट बनाइदिनु भएको पनि हार्दिक धन्यवाद दिन चाहन्छु। नेपाल सरकार अहिले मानसिक स्वास्थ्यमा जति काम गर्नुपर्ने हो त्यति काम गर्न नसके तापनि गत 2-3 वर्षदेखिबाट हामीले हाम्रा कम्युनिकेबल डिजिजेसको साथ हामीलाई नछोड्दै पनि अब नन कम्युनिकेबल डिजिजेसले 70-80% मृत्यु गराउँदै गएको अवस्थामा र त्यसमा मानसिक स्वास्थ्य पनि आउने अवस्थामा हामीले मानसिक स्वास्थ्यमा जति काम गर्नुपर्ने हो त्यो गर्न सकेका छैनौँ। हामी प्रयत्नरत छौँ। यत्रो ग्यादरिङ देख्दाखेरि खुसी पनि लागेको छ। यो क्षेत्रमा काम गर्ने साथीहरू थुप्रै हुनुहुन्छ। योभन्दा अगाडि पनि डाक्टर अरुणले गर्नुभएको एउटा कन्फरेन्समा पनि 200+ एउटा चाइल्ड एन्ड एडोलेसेन्टको साइकियाट्रीको एउटा कन्फरेन्समा 200+ पार्टिसिपेन्ट नै हुनुहुन्थ्यो। भनेपछि जुन अवस्थामा मानसिक स्वास्थ्यमा हाम्रो देशमा विकास भइरहेको छ त्यो प्यानले कन्टिन्यू गर्न सकोस्। यो प्यानको 2 दिने कन्फरेन्समा जसले भाग लिनुभएको छ, जसले पोस्टर प्रेजेन्टेसन गर्नुभएको छ, जसले पेपरहरू प्रेजेन्ट गर्नुहुन्छ, उहाँहरू सबैलाई शुभकामना दिँदै तपाईहरूले प्यानले देखाएको बाटोमा अगाडि बढ्न नेपाल सरकार तयार छ। कृपया मार्गदर्शन तपाईहरूले प्यानले हामीलाई दिनुस् र स्वास्थ्य मन्त्रालयले मानसिक स्वास्थ्यमा कसरी अगाडि बढ्ने भन्ने मेरा अग्रज, मेरा सिनियरहरूले हामीलाई बाटो देखाइदिनु भयो भने हामी त्यही आधारमा बिस्तारै भए पनि थोरै भए पनि केही न केही प्रयत्न गर्नेछौँ। प्यानलाई शुभकामना भन्दै बिदा हुन्छु। धन्यवाद, नमस्कार।
Thank you, Dr. Roshan Pokhrel, sir. Now, I would like to request the scientific convener, Professor Dr. Dhana Ratna Shakya, to say a few words.
Respected chairpersons, our Dr. C.P. Sedai, chief guest, our own Health Secretary Dr. Roshan, respected dignitaries on the dais, my seniors, colleagues and the family members, namaste and welcome. So I just wanted to say thanks to PAN and organizing committee for bestowing me this responsibility of being a convener and editing the souvenir. So thank you very much for that opportunity, and also the authors who have given their valuable contribution as authors, and the presenters, of course, they have their work presenting in this very important event. So, and of course, all the delegates who are listening and giving the feedback. So, thank you and thank you. And also as a convener and academic editor-in-chief, I learned a lot from what you have contributed. And also I call all of you, presenter, authors, delegates, for your active participation and contribution to make this event successful by your contribution, active participation and presentation. So once again, I call you, welcome, and thank you very much.
Thank you so much, sir. Now, I would like to request the Nepal Medical Association Central Vice President, Dr. Anil Karki, to share his thoughts.
Thank you very much. Mr. Chairperson, Chief Guests, dignitaries on the dais, all the national and international delegates, friends from media, friends from pharmaceutical companies, a very warm afternoon from Nepal Medical Association. First of all, I would like to thank the organizers of 9th PANCon for inviting Nepal Medical Association to be a part of it. I think I should really condemn the psychiatrist for understanding the human brain, which is very complex and very difficult. And I think it takes a lot of pain, because human brain is very difficult, and to tame a human which is abnormal from the normal thing is a great job. So I think congratulations guys for the job you have been doing. Second thing, I would wish the conference grand success, and few issues like I would have loved if the health secretary would be here. What we as medical association have a genuine concern in mental health is all the antipsychotics by law being prescribed by people except being doctors, which is a large group of practice in the periphery, I understand, but I was quite shocked that it is legalized in Nepal. So I think it's high time that PAN should advocate on that. The second thing, I think the taboo about mental health, whenever if we refer a patient to psychiatrist, at times we do face difficulties. So I think the association should work real hard on creating an environment that we other practitioners can feel free on referring you. Sometimes we have to get scared, especially in my field of practice, where we have a lot of patients suffering from cancers, and we want a real good counseling from the psychiatrist people, but the cancer ko birami ho, pagal ko ma pothako. And the third thing, what really concerns us is being the stress factor, I don't know, the suicidal rates in the medicos is really going high. So I think Ministry of Health, we association and psychiatric association should work together to really create a safe environment and decrease the suicidal rates and suicidal tendencies that is coming in young medicos. So I wish this conference would definitely give good guidelines on all these things, and we at Nepal Medical Association believe in unity, fraternity and service, and we are always ready to work with all associations like this. Thank you very much. Please enjoy your stay at Chitwan. Chitwan has a lot of flora and a lot of things to explore. I wish the conference a grand success. Thank you very much.
Thank you, sir. We have come to the end of today's inaugural session. And to deliver his speech and also the closing remark, I would like to request the chairperson of the program, respected Professor Dr. C.P. Sedai, to come forward.
Namaskar. Respected Honorable Chief Guest, Secretary of Ministry of Health, Roshan Pokhrel, just left because of the busy schedule. And I like to welcome NMA Central Vice President. I extend to welcome NMA Chitwan President and Hospital Director and Clinical Director of Chitwan Medical College, all the dignitaries on the desk. And similarly, I like to welcome all psychiatrists from different parts of the country and foreign delegates, residents, journalists, each and every individual present here. A very warm welcome, dear ladies and gentlemen. We are highly obligated by your gracious presence. Today is a auspicious day, and I am delighted to announce the opening of the most awaited event of the year, 9th National PanCon, first of kind, to be organized in the Sauraha, Chitwan. This conference is for sure one of the kind. It is definitely historical to pursue with the introduction of the theme of the conference, mental health in changing world, which is quite relevant in the present scenario. To briefly summarize, this conference we will conduct scientific paper presentation, theme session, oral presentation, symposium, panel discussion, plenary session, free paper, workshop, poster display, etc. So, dear participants, it will definitely be fruitful. In the ancient era, it was believed that mental disorder was supernatural origin. Since then, the new viewpoint toward the mental illness has drastically changed. Now the recent concept has changed. The etiology of the mental illness is planned on the basis of biopsychosocial model. To mention a few of genetic factor, personality factor, disturbance of the neurobiology, neurochemistry also take vital part in the development of the mental illness. Social media has made the world very constricted and small place to live in, but at the same time, electronic media addiction has added extra mental health problems, including anxiety disorder, PTSD, depression like that. According to WHO report 2022, one in every 8 people in the world live with mental disorder. 1 in every 8 people in the world live with the mental disorder. Similarly, WHO data 2029 shows that 301 million people in the world were living with anxiety disorder. 280 million people were living with the depression. 40 million people experience bipolar disorder. Schizophrenia affect approximately 24 million. There is huge mental gap between burden of mental disorder and available resources. It is even more prominent in developing countries. WHO is working to reduce this mental health gap. To review the COVID-19 pandemic that is scattered distress in the world, the one of kind which the world had never faced. WHO recently reported that the COVID-19 pandemic caused 25% increase in the prevalence of the anxiety and depression worldwide. Talking about the history of Nepal, Before 1961, mentally ill people were kept in the Dhulikhel jail as a prisoner. There was no place to take psychiatric patients at that time. Many psychiatric patients were taken to the traditional healer with the hope of successful treatment. Some psychiatric patients were taken to the Ranchi, India for treatment. In 1961, first psychiatric OPD was started in the Bir Hospital. In 1972, 10-bedded neuropsychiatric unit was established in the Royal Army Hospital, which was then shifted to Langankhel. I want to highlight few data of Nepal, mental health data. National Mental Health Survey showed that, recent mental health survey showed that prevalence of the mental disorder is 4.3% on adult and 5.2% on adolescents. Health budget as a proportion of the mental budget is 6.15%. Mental health budget 0.2%, which is quite low. Number of psychiatrists 220 till now. Psychiatric bed about 500. Clinical psychologists about 30. So we can say that current mental health service in Nepal is still not satisfactory and not for the WHO standard. Similarly, psychiatric population ratio is also low in comparison to the WHO standard. The following need to be addressed by the government. There is need to increase budget on the mental health. There is need for initiation of various sub-specialty programs, child, adolescents, geriatric, addiction, forensic, like that. There is need to fill existing vacancies, increase recruitment of the psychiatrist, create position for clinical psychologist, psychiatrist nurse, psychosocial counselor, and community-based psychosocial worker in the government healthcare system. The government should prioritize mental health research and anti-stigma campaign in the community level. The government should have provisions there should be post of one psychiatrist in 50-bedded hospital. I believe 9th PANCON will provide a platform to share knowledge, idea, experience about the psychiatric patient management. It will guide us through the current scenario and make aware of how and what should be done in near future to Finally, I would like to thank you all on the behalf of Psychiatrists of Nepal, wishing you a very successful and fruitful 9th PANCON ahead. I would like to remind you in the end that Psychiatrists of Nepal is always progressive, dynamic, most importantly receptive to all the activities. Thank you. We are a little bit late, so I announced the closing of this session, inauguration program. Thank you.
Thank you, sir. Thank you, everyone, for your gracious presence. Kindly proceed for lunch.